Yes, good day, able students.
Yes,
Once
good day,
again,
every
I
student.
welcome you
Once
to
again, I
this
welcome you
class
to
of
this
e-facilitation.
class
I am
of
Dr.
e-facilitation.
Abayomi
I
Samuel
am Dr.
Bankole.
Abayomi
We are
Samuel
actually in the third week
Bankole. We are
of this
actually in the third week
e-facilitation on
of this e-facilitation
ANP506.
on
We have been able to
ANP506.
look at the
We
first
have
two
been able
topics
to
the last
look
two
at the
weeks.
first two
The very first
topics
one,
the last 2 weeks.
reconsider
The very first
the
one,
basic terms used
reconsider
in animal health
the basic
and
terms
diseases.
used in animal
Last
health
week,
and
we dealt
diseases.
with
Last week,
the
we dealt
factors
with
that
the
affect the health status
factors
of our
that
animals.
affect the
Now,
health
this week,
status
we
of
want to
our
consider
animals.
a
Now, this
general
week, we want to consider a
classification
general
of livestock
classification of
diseases, their
livestock
prevention,
diseases, their
control,
prevention,
and eradication
control,
strategies.
and
I'm
eradication
very sure
strategies.
you
I'm
already
very sure
enjoying
you
this e-facilitation from
already enjoying this
week one through to
e-facilitation from
two and now.
week one
And
through
of
to
course,
two
today will not be
and now.
different.
And of
Now,
course, today will
without
not
waste
be
of time,
different.
I
Now,
want to welcome
without
you
waste of
to
time,
class
I
and
want to
let us
welcome you
just
to
go to
class.
class. Let us see
And
what
let us
uh,
just
we
go to
shall be
class. Let us
considering
see what
today. Once
we
again,
shall be
you
considering
are
today.
highly
Once
welcome.
again, you are highly welcome.
Yes, you are highly welcome. The topic again is the general classification of livestock diseases, their prevention, control, and eradication strategies. Uh, you know my name already, to Abayomi Samuel Bankole, your course facilitator for ANP506. You can always reach me using this uh, institution email, Bankole at noun.edu.ng. Now, if we want to go into the introduction, you will remember or recall that in the last two classes, we have a term we have been describing, but not just one actually. There are a number of them, and one kept on ringing bell in our ears. That term is disease. Disease, yes. In the last class, I described disease for you very well. Because we are classifying livestock diseases today again, disease is coming up. Now, disease uh, is described as that condition resulting in a deviation from the normal functional or behavioral status of an animal. And diseases can either be classified uh, as infectious or non-infectious. Infectious diseases are those diseases that are caused by pathogenic microorganisms such as bacteria, viruses, protozoa, and fungi. And of course, parasites are there as well. And they invade animals' body and spread. They can spread from one animal to another, either directly or indirectly. On the other hand, non-infectious diseases are not caused by pathogens per se. Rather, they can result from some management factors or environmental factors, or they can even be inherited, they can be genetic. And so we'll be looking at some of these today. As we go on in today's class, we'll be having in mind three major intended learning outcomes. Number one, you are expected to know the major classification of livestock diseases. Of course, that's our major topic today. You also need to understand the methods of disease transmission in animals. And lastly, you want to identify the prevention, control, and eradication strategies to curtail this livestock diseases. Let's look at causes of diseases. Causes of diseases. Before we look at causes of diseases, what again are diseases? And how do they perform their role, as we may put it, in animals' body? Diseases, like we said, are caused mostly by pathogenic microorganisms or parasites that invade, colonize, and multiply within the animal's body, that is, in the host cells. And this action of invading, colonizing, and multiplication usually cause significant change in the animal's body. These pathogens, like we said in the previous slide, can be bacteria, viruses, fungi, protozoa, parasites. Now, the first man to associate a specific microorganisms to a particular disease was Robert Koch in 1877. He attributed the disease anthrax to the organism called Bacillus anthracis. Now, there are other causes of diseases apart from pathogens, which include injuries, poisons, or chemicals, poor nutrition, or those that originate from hereditary sources. Now, the manner in which diseases develop, that is pathogenesis, actually differ from one disease to another. Now, let's look at methods of disease transmission. Methods of disease transmission. Now, diseases are transmitted from one animal to another through three major ways. One, contact transmission. Contact transmission. What do we mean by contact transmission? This can be by direct contact between animals that are staying together in the herd or flock, or when they meet in the open field, or in animal markets. When farmers take their animals probably for sale in an open market, they meet other animals there, and not all of them will be healthy, so they can contact disease by contact, as the word contact. Now, it can also be by indirect contact, when animals come in contact with other objects that a sick animal had previously had contact with. Now, these objects may be non-living, such as syringes or put worn by attendants, feeding troughs, pasture, etc. Number two method of disease transmission is vehicular transmission. Yes, like vehicular transmission. Now, this type of transmission occurs through a medium, which can be by feed. Of course, that will cause food poisoning, or can be by water, can be by hair, spores, can be by fluid, probably saliva, and all of that. So, the third method of disease transmission is vector transmission. Vector transmission. This type of transmission refers to other animals that carry disease-causing agent from one host to another, and the majority of these are insects or arthropods. Now, vector transmission occur either mechanically or biologically. In mechanical transmission, they passively carry the pathogens on their bodies. This is on their body parts. For example, botulism. Maggots feed on carcasses, and they can transmit this to susceptible hosts unknown. among to that host. Now, in biological transmission, there is the involvement of biting action and part of the life cycle of the pathogen occurs within the body of the vector. Example of this we can see in malaria transmission through the biting action of mosquito, or we can also see in trypanosomosis transmission through the biting action of tsetse fly as a Glossina species. Now, let's go to the crux of the matter today, classification of livestock diseases. Now, livestock diseases can be classified using various criteria depending on what best satisfies the situation at hand. Now, we have three major classifications we dwell on today. One, species, that is classification based on species of animals, and we can have avian diseases in birds, bovine diseases in cattle, equine diseases in horses or equids, the camels and all of that. You can have caprine diseases in goats. You can have canine diseases in cats and dogs, etc., etc. Now, we can also have livestock classification based on system of the body affected. For example, you can have cardiovascular diseases, because that involves the heart and the blood vessels, respiratory diseases, reproductive diseases, and so on and so forth. Now, the third classification of livestock disease is the etiology or causative organism classification. Now, this particular classification, that is the etiology or causative organism classification, is the most widely used criteria of livestock disease classification. And here we have about 9 listed here with examples. Number one, bacterial diseases, of course, because the disease is caused by some bacteria. And under this, we have examples such as anthrax, mastitis, salmonellosis, fowl typhoid, etc., etc. We have viral diseases, that's number two. Examples include foot and mouth disease, rinderpest, African swine fever, etc. Number three, we have protozoan diseases. Examples are coccidiosis, trypanosomosis, babesiosis, and so on and so forth. Number four, etiology classification is rickettsia diseases. Rickettsia diseases. Examples are anaplasmosis, cardiosis, that's at water, infectious keratoconjunctivitis, and so on and so forth. Number five, etiology classification is fungal diseases. Fungal diseases, e.g., aspergillosis, ringworm, epizootic lymphangitis, and so on and so forth. We have number six. Yes, we still continue. Number six is endoparasitic diseases. That is diseases caused by worms, internal worms, we call them. Examples include fascioliosis, pneumococcosis, and so on and so forth. Number seven, etiology classification is ectoparasitic diseases. These are caused by ticks, lice, and fleas, and examples include mange, flea bite, dermatitis, and so on and so forth. Number eight is deficiency diseases. Deficiency diseases. Examples include vitamin deficiencies, pregnancy, toxemia in goats, late pregnancy, or ketosis, that's after birth when goats begins milking, and so on and so forth. Number nine, we have toxicosis, e.g. includes nitrate poison, lead poisoning, etc. Here we have your class activity 1. Yes, that is a class activity. Please ensure you attend to this class activity. It is very, very important. Let's continue in the class. We have been able to classify diseases. We have seen different modes of or methods of disease transmission. And now, if we have done all of that, and we don't have a means of stopping or curtailing these diseases, then we will be at great loss. Our animals will keep dying without end. So, what are the prevention, control, and eradication strategies for curtailing livestock diseases? We have 3 of them right here. Of course, prevention. Now, prevention in this sense simply means avoidance of diseases. You want to avoid disease from entering into the herd or affecting any animal for that matter within the herd. Control. What do you mean by control? Control refers to the reduction in disease incidence or prevalence. You want to ensure that disease don't just continue to spread without any control. Probably you had some kind of infection just trying to get established in a herd. Probably it has affected 1 or 2 animals. How do you control it so that it doesn't go to the 3rd and the 4th, and of course to hundreds of animals that you have? So that is what we mean by control. Eradication. Now, eradication refers to complete removal of disease from a geographical area. You don't even want to see this disease getting established at all. So what do you do? So these are the things we'll be considering here. Let's start by prevention. Methods for prevention. The 2 major methods used for prevention of livestock diseases are aimed at stopping a disease from getting to a herd or flock or group of animals. And these 2 methods are quarantine and vaccination. What do we mean by quarantine? Quarantine, that's number 1, is the physical separation of healthy animals from the sick or new animals. If you are just getting some new animals, you don't just add directly into the herd. You want to separate these animals for some time, maybe for like 3 weeks. I explained this in the last class very well. So if you're in that class, you will understand what we are talking about right now. So you want to separate this animal from the healthy ones, meaning the sick one from the healthy ones, or the new ones from the already existing one in the herd. Now, this can also be done, that's quarantine, can also be by the restriction of items used between these 2 groups of animals, the sick and the healthy, or the new and the existing one in the farm. Now, all new animals to be added to a farm or herd normally should be quarantined, tested, and or treated appropriately before introduction into the farm or herd. Just explain that. Now, where very strict quarantine is practiced, the herd is completely closed to live animals, and usually artificial insemination is employed. Number 2 method for prevention of livestock disease is vaccination. Vaccination. This method is used where exposure to a disease is likely, and in the hope that vaccination will protect the animals if and when exposed. Now, vaccination is usually based on the principle of herd immunity and suppression of disease when individual animals are resistant. All animals are usually vaccinated using suitable vaccination. I would like you to go find what we mean by herd immunity. I will ask you in the next class what we mean by herd immunity. Yes, please go and check that out. Now, what's a vaccine? A vaccine is a biological substance which stimulates the body's immune system to produce antibodies against a particular disease, such that that disease will not overwhelm the body of our animals. Vaccination should be done as close as possible to the period of greatest risk in the animals. That is when the animals may be affected with particular disease that is being vaccinated against. Now, vaccination should not be carried out during period of stress on the animals. Please avoid that. You don't vaccinate an animal when the animal is already stressed. You may be compounding the situation at hand. Now, diseases commonly vaccinated against in Nigeria include rinderpest, anthrax, Typhus bovine, pneumonia, cattle, all these three cattle. We have fowl typhoid, Newcastle, fowl pox, and so on and so forth in poultry. And we have rabies in dogs. Let's look at the second method to curtail the livestock diseases in our herd, and that is control. So we'll be looking at methods for control of livestock diseases. Now, control methods generally are aimed at reducing disease to a particular and to a level that is tolerable or economically feasible. There are three major goals for control of livestock diseases. Number one is to decrease the prevalence of existing disease. Number two is to decrease the incidence of new infection. And three, to decrease the morbidity and mortality rates. We are talking of decrease here because there is disease already, but we don't want it to spread, like I said earlier on. So we are decreasing incidence, decreasing new infections, we are decreasing morbidity or mortality, that's death rate, that can come as a result of this disease infection. Now, these goals are achieved by identifying the infected animals or herd, and this is followed by one, treatment. So this is a major method for control. Now, treatment. All infected animals are promptly treated with appropriate therapeutic agents, and this method depends on the availability of cheap and safe drugs. Now, the use of broad-spectrum antibiotics and antihelminthics are useful in achieving mass treatment. Now, let's go to number two method for control of livestock disease, and that is sanitation. Yes, sanitation. Proper hygienic practices that will ensure and maintain a clean environment where animals are housed must be constantly practiced. clean water and proper feeding troughs should be provided, as well as fecal contamination of feed and water are known to be viable sources of infection. So we should know that we need to provide clean water and feed our animals so that they don't become sources of infection to our animals. Now, for grazing animals, uh, sanitation or some control can be established using the method called grazing rotation. Grazing rotation. So you don't continually graze your animal on one portion of the or the grazing pasture. So you move, you rotate them if you adhere to them. And the essence of that is because when the animals grazed yesterday will definitely be contaminated with fecal uh, materials. They will defecate there. If they go there tomorrow, even though there are enough grasses there, the tendency of grazing the grass along with the fecal material is very, very possible. And so, by that, infection or disease is being introduced. So, you want to do grazing rotation. Now, the aim of eradication, sorry, now this let's look at it. This is the third, actually, the third uh, method for controlling or curtailing our livestock diseases is eradication. So we have methods for eradication. Now the aim of eradication is to eliminate a disease completely from a hard and or geographical area. Generally, the means of achieving disease eradication is known as depopulation. Yes, depopulation. What do we mean by depopulation? We shall see as just here now. Now, depopulation. Depopulation is usually employed when other means of controlling or preventing a disease are not likely to achieve the desired result. Or maybe this is a very devastating disease and it's just destroying all our animals. What do we do? We depopulate. And this is usually used to completely stamp out a disease. You don't want to see that disease continually spread. So, and this requires that all animals, listen to this, it requires that all animals or species concerned in a particular area or farm are killed or destroyed. Oh, you say, oh, that is it. Because if those animals are not put down, the whole flock will be affected and you may lose all the flock or the herd entirely. So you want to destroy the ones that are severely affected. If some can be treated, you want to handle them that way and you separate them from each other. We talked of quarantine earlier on. So this is important. Now this method of eradication works best in developing countries like Nigeria when implementation is compulsory and is initiated and supervised by the government with compensation plan for the affected farmers. The destruction can either be total or limited. Now, where limited destruction of animals is to be applied, it is preceded by testing to identify affected animals to be destroyed. This is known as test and slaughter or test and removal. Now, this method usually relies on the use of sensitive diagnostic tests. identify animals to be removed and the economic costs of the removal well considered. Now, this is class activity 2. Yes, that is it right there. Please, like I said earlier, ensure you attend to these class activities. Very, very important. Now, in summary, what have we done today? We have been able to, one, classify livestock diseases based on different criteria, and we emphasize the etiology or causative criteria as a widely accepted method for livestock disease classification. Number two, we describe the various modes or methods of transmission of livestock diseases. And lastly, number three, we identify the conventional strategies for disease prevention, control, and eradication. Yes, before I go, we'll be stopping here, but before I go, please ensure you constantly visit virtual learning environment. It is very important for you to access the videos, instructional videos, and not only just instructional video. You also want to look at what is happening there. You have some class activities you have to do, you have to check there. You also want to check the discussion forum and many other wonderful things going on right there. So please ensure you always visit the virtual learning environment at least 3 times a week, Monday, Wednesday, Friday, or at any other time convenient for you. Very important. Till we meet next time, I say bye bye from here. Bye bye from here. Please keep safe. COVID-19 is real and it's still out there. Bye bye.